Okay. Okay. Hello, everyone. I'm Dr. Ayush Pandey, and let us begin this interesting session of this very interesting course on physiotherapy practitioner certificate. So, in this module one, we'll be discussing the basics and overall view about the history and how there was evolution of physiotherapy over the period of time, right from the ancient BC times to the AD until the current 21st century. We'll be discussing also about the scope and significance of physiotherapy in the current healthcare scenario and healthcare settings. And we'll be discussing about the ethics and professional responsibilities, what should be of a proper physiotherapist. This module will be dwelling into the deeper parts of the physiotherapy. But before going to the, dwelling into the deeper part, what exactly you have to understand, what exactly is physiotherapy? So physiotherapy is also known as physical therapy, and it is definitely a branch of healthcare which assists people. So it acts as a guiding tool. It helps to assist people, and whom people it is useful. So in people who have been suffered with injury, any illness, any disability which have caused them lifelong disability or trauma, and these people are being assessed or being helped through various modalities, manual therapy, therapeutic exercise, and through proper patient education and proper care. When we go to the ancient Greek times, so the Greek physician, very famous physicians, Hippocrates, who is also known as the father of medicine, advocated the use of massage, hydrotherapy, and manual manipulation for the healing injuries and illness. So you see this right from the times of 460 BC, the Hippocrates has already documented it. We have also seen this during the Middle Ages, that there was a slowness due to the any because of the there was a lot of religious and cultural restrictions. But however, because of the religious traditions also, palliative care, the need and the role of physical rehabilitation come into play. After 1800, when we landed up into the 20th century, there was the rise of typical modern physiotherapy, and especially the world wars play a very important or a pivotal role in shaping the rise of modern physiotherapy. Holistic models like, physiotherapy, mental health, and nutrition, individuals with respiratory and heart conditions, like COPD, asthma, ILD, in fact, post-heart surgery, congestive heart failure. So techniques to improve the lung function, exercise capacity, tolerance, aerobic fitness is definitely the need of the hour. Geriatric physiotherapy, managing the physical issues that is associated with aging. And with aging, you see the patient becomes frail, becomes, there is decline in the bodily organs, there is osteoporosis, the bone becomes weak, the patients develop more tendency to falls, prevention. So emphasis should be on maintaining the independence, strength, and mobility. So there are basically six main important points when you talk about the ethical and professional responsibilities of any healthcare provider. The first thing is the autonomy, that the respect for the patient's right to make informed decisions is a basic fundamental principle. So non-discrimination has to be followed. Professional competence, physiotherapists are responsible for staying updated with the latest evidence and research. So continuous, you have to treat, you have to, so you have to be updated with the latest healthcare trends, regular training and clinical practice. Why? To maintain that high quality of standards of care which you provide to the patients. Responsibilities, ethical dilemmas, and professionalism. So you must, navigate the ethical dilemmas in the conflict of interest, dealing with difficulties, patients, or ensuring a professional integrity of their practice. Upholding professionalism includes what? So, a proper professionalism ensures your respect for the patients, your respect for your team, your colleagues, your punctuality, and it offers a continuous self-reflection and growth on a day-to-day basis. So, the only thing which will save you is the documents. So a proper complete maintenance of the patient records, accurate maintenance has to be there. You have to understand the potential for legal liability in case any malpractice happens, to minimize the risk through adherence to the establishment of the standard of practice and through proper documentation. So everything is being very much needed. So hereby I end my session and open to any Q&As if it is being there. So we have discussed the basics of the physiotherapy. We have seen the evolution of the physiotherapy. We have gone to the scope of physiotherapy in the current healthcare trends. And the third part we have covered is the professional and ethical responsibilities or liabilities which a physiotherapist have. So in the coming or in the next sessions, we'll be dealing into the, deeper parts or dealing into the more parts of the physiotherapist specialty wise also.